Let's talk about Delhi's air quality. It has plunged now to severe plus category. It's happened for the first time this season. It has prompted the government to implement stage 4 of the Graded Response Action Plan, GRAP. Now, the Supreme Court today has pulled up the Delhi government for the delay in implementing GRAP 4 measures, which will stay in action until further notice from the Supreme Court. Now, there is a lot of political crossfire. Delhi's AAP government has blamed the centre and essentially no comment from the BJP at the centre just yet. But let's get perspective. Dr. Rajesh Chawla, Senior Consultant Respiratory at Indraprastha Apollo Hospitals, and Vimlendu, Environmentalist, both these gentlemen joining us on the show. Mr. Jha, Delhi is smothered in toxic smog. Pollution has hit record levels. Stage 4 restrictions have been put in place. There has been this rising number of cases of respiratory, cardiovascular diseases. Tell us, in your understanding, what the current situation is like and how does it compare with this kind of situation that we've had consistently over the years in Delhi?
So the situation is worse than what the government wants us to know. Reality is that the government monitors are still giving us numbers like 550 or 480. As until this morning, the average AQI of Delhi NCR was around 480, which is severe plus, and that's where perhaps GRAP 4 was actually executed. But if you actually look at most of the private air quality monitors that Delhi NCR has, they all have been giving numbers of figures almost plus of 1500, which is 3 times worse than what the government figures are, and perhaps 20 to 30 times worse than what the permissible air quality limit should ideally be in any place. So the situation is really worse. I'm sure it's not just about numbers here, and therefore, what the court was also talking about is that it's not just about bickering over numbers. Reality is that every other person in Delhi NCR is actually having an itchy eye or breathlessness or pain in their throat, or in fact, I'm sure the doctor colleague that I have here will talk about how the ICUs are getting filled because of the kind of issue. So it's a grave situation. After many, many years, we've actually had in mid-November, air quality index reaching severe plus levels, and situation is only going to get worse. Please understand that indeed for the last 2 days, because of the northwestern wind, because the wind direction changed, and therefore farm fires have actually started. The smoke from the farm fires have started to reach Delhi. But in a couple of days, when the temperature goes down and the wind speed reduces or the direction changes, and Delhi, because of the geographical disadvantage and the meteorological condition that it has, situation is only going to get worse. Situation in ideal, in most countries, 300 is when cities are shut down. There's almost a lockdown or an evacuation plan that city governments actually have when AQI reaches 300. Here, you and I are staring at 1,000, which is almost the government's number, and 1,500, which is private monitors, and still it's business as usual. There's as much traffic, and there's almost nothing that we've actually heard so far from the central government, and there's only bickering and blame game politics that we've actually seen from the local government of Delhi NCR.
Indeed. Dr. Chawla, do weigh in on this. Tell us, I mean, at these kind of levels, like many are pointing out, including our environmentalist friend Vimlendu, he's saying that cities are locked down. What are we lacking over here that we have this consistent problem and yet no solution? How much worse has it gotten now that you're treating patients with pulmonary problems?
Every year, everybody related, whether it's a media or the environmentalist or people, everybody talks in these months.
Yes.
And the whole year, very little talk about air pollution. And it is an all-year problem now in Delhi, and you will not find the AQI touching the safe level any time of the year. And unless the center comes into takes a lead, it is very difficult to control this, because you need to make very, very big steps to really control this. Like they need to change to electrical vehicles now, unless on a long-term plan they do it. I don't find this solution. Every year, this level is increasing. I mean, this kind of Delhi I've never seen since I was born. Today, when I was walking on the road, I mean, you can't see at 6 o'clock, and it's smelly, and you feel suffocated. And that's what we are going to give to our children in the coming years. And if you see, it has not only the impact on the respiratory system, this air pollution has impact on every system of the body. You know, of course, because you inhale the polluted air, it has a direct impact on the respiratory. You get a chronic bronchitis, COPD, exacerbation of asthma. And now in non-smokers, air pollution, 10 to 15% of lung cancers, they are because of the air pollution
Yes.
in females. And in country like India, they're talking, there are other factors also, like it causes the mutation, genetic mutation in the DNA, and over the prolonged exposure, they have seen not only the lung cancer, even the breast cancer, and the other cancers have also been related. People get more strokes, heart attacks, neurogenic. If you talk about the neural problem, the genetic, neurogenetic degeneration, like people get Alzheimer's more, the efficiency of the children, the IQ of the children is less. You know, there are far-fetched implications. Probably we've not studied much, but it has definitely. Every minute, 12 times a minute, you are inhaling a polluted air.
Yes.
So how can it be without any impact on your body?
So it has
And
far-reaching implications, doctor, but have you noticed lowered immunity levels affecting citizens now after the pandemic that much more? Has that compounded the problem?
no, even the air pollution results in the decreased immunity. I mean, it has definitely, because when they have said that people exposed to the higher level of air pollution, it decreases your immune, more chances of infection, particularly in children. The more chest infections they get. And you know, another problem, because I'm a pulmonologist, what I have noticed is whenever a person gets upper respiratory tract infection, it takes much longer to cure in Delhi. Used to take 2, 3 days. Now the cough persists for many, many months, many weeks. And even asthmatic, they take longer to respond and their symptoms last longer. You know, it has, and even talk about pregnant ladies. You know, not only there is a more preterm delivery, the child weight could be less, the child could be weak, and there are studies to show that there could be possibility of a birth defects also. And of course, the decreased immunity. So there are a lot of effect. We
Yes.
all know it,
Yes.
but it has to be a long term. Otherwise, we are not going to produce strong generation ahead.
So, Vimlendu Jha, all these measures that we are taking up, like grap 4, etc., it seems like we wait for the extreme to happen before we come in with these stopgap arrangements, because that's what it's turning out to be. Meanwhile, the middle class is getting hit. They're already suffering from high prices of essential goods, food, day-to-day items. Now there is that added pinch from the rise in health-related expenses, air purifiers, masks, you know, visits to the hospital. All of these costs, they put household budgets under stress as well. So we have double whammies and quadruple whammies.
Absolutely. So first of all, it's not, these are not solution. GRAP is not a solution. This is an emergency measure. You're not left with anything but just to shut down / lock down. Solution is to really look at the source of pollution. Wherefore we know that from the episodic sources of pollution or the perennial sources of pollution, almost 40 to 50% of Delhi's ambient air quality is affected by the vehicles, the private vehicles that we actually have. Vehicular pollution contributes to 40 to 50% of pollution. Similarly, construction demolition activities around 30%, and also including the dust from roadside. So, when we look at a grap 3 or a grap 4, these are only knee-jerk, stopgap, band-aid, low-hanging emergency measures and not indicative of governance. What we actually need is long-term and medium-term governance solutions when we know the problem. And it's not as if we've only known about air pollution in 2024. We've been grappling with this situation for last 10 years minimum. Of course, the fact is that perhaps we actually had this issue longer, because air quality monitors in Delhi, we have around 39 to 40 now. We only had 4 earlier, so we didn't even know what air were we actually breathing earlier. And now, therefore, there's some sort of a government data, as I earlier said, that we don't even know whether the air quality index of Delhi NCR is 500 that the government tells us, or it's 1500 that the US and the Swiss bodies are actually telling us. And reality is that when we look at the, it's in more likelihood, or in most likelihood, is the international data sensors or monitors that's actually giving the right numbers. And also what Dr. Saab was talking about, at the end of the day, every other child in Delhi is actually born with stunted, lung, as in every third child actually has asthma. There's Lancet report talks about 1.5 million people die in India because of air pollution. We're not even talking about morbidity. We're not even talking about life expectancy going down by 10 to 12 years. It's a grave issue. But the most unfortunate part is that the political class, which is the government at the center, government of respective states or the municipalities, they only wake up in the month of October, that too only winkingly, that too very partially, and don't do anything about it. As in, at the end of the day, shutting down or odd even, or putting the onus of accountability onto citizens that they should not go to school, or they should not go to office, or they should not take their car. That's not what called governance. Governance primarily means that we actually look at the beginning of the pipe solution, where we identify the sources of pollution and take measures. Right now, as Dr. Saab was talking about, that is no more an environmental problem. And Dr. Saab, just for your knowledge, environmentalists do raise this issue throughout the year. But there's no political uptake, there's no political urgency or political will to talk about issues like these. And unfortunately, this is not Supreme Court's job to really talk about what should it be done. So Supreme Court is not our governance body, but glad that at least Supreme Court is talking about it. But imagine if there was no Supreme Court, there was no grap 3, there was no grap 4, we could have only waited for weather gods to improve the air, and we were all Ram Bharose or Bhagwan Bharose or Allah Bharose, and that's how things would have actually happened.
But Mr. Jha, why do you think that's the case? Why do you think we don't have political will at this point in time, like for the general administration, for the state governments to come together, Punjab or Haryana, to talk to the government of Delhi, for example? Something as basic as that has not been done to be able to control stubble burning. Why do you think we are not able to get that political will going? What's your reading?
I think largely issues of environment, be it of water, when we, of course, I'm sure on your screen right now, you're also showing visuals of frothing Yamuna. On most environmental issues, we don't think that that's urgent because it comes and goes. Suddenly, there'll be a rain tomorrow, and ET now and everyone else is going to forget about it. As Dr. Saab said, that Delhi's air is polluted throughout the year. It's only because of geographical disadvantage that Delhi has and the meteorological condition that we face in the month of October, November, and December. Air quality index spikes. But that doesn't mean that there's no pollution in the month of January or February or March or April or in July and August and September. It's just that it rains a few times and we feel that, oh, well, the air has been cleaned. And sometimes the government of our day tweets and says, oh, well, they have cleaned the air. But it's actually the weather gods, it's the rain that has cleaned the air. So, the unfortunate reality is that environmental governance is not part of the political agenda. There should be an uptake demand by the citizens who are the most affected, as you rightly said. Forget about middle class that has to pay more. It's the lower class, as in at the end of the day, when there's a lockdown, when construction and demolition activities are shut, it's not you and I. You and I can work from home or perhaps do many of those things. It's the poorest of the poor who gets affected more in terms of livelihood, that is one, and two, in terms of their life, because they're the ones who live in most poor neighborhoods where the air quality index, the 13 hotspots of Delhi that we're talking about, are mostly which areas? These are industrial areas, poor neighborhood areas. And then the third is the medical bill. At the end of the day, they don't have access to an air purifier or a pulmonologist or a private ward and an ICU. So it's a public health emergency that needs to be dealt with utter urgency. And that's where perhaps you need to understand that a city like a capital like Beijing had a similar crisis earlier.
It did.
And many other cities of America had an air quality crisis.
Yes.
They were able to fix it because they realized that development can be stretched and paused. Air, life of our children and our mothers and our elderly is more important than a flashy flyover or a fancy mall in the middle of the city.
So do these two have to be put in the balance? When we talk about our dreams of a Viksit Bharat, Dr. Chawla, do weigh in on this. You do speak from a medical perspective, but also from a long-term perspective. If we are going to have a developed economy, at this stage, when you have AQIs touching 1,000, is that the route that we are taking? What's your understanding of this?
I expect very bad if we do not take actions now. If we take some action now, I think 10 years from now, you will have a clear air, maybe a safe AQI. It's not going to be easy. because the constructions will happen, and for economy, they want to sell vehicles. It has to be a very strict and hard step have to be taken, and probably at the prime minister level. I have been thinking that the only way you phase out the petrol or diesel vehicles out of Delhi. You slowly give incentives, whatever way, because 30 to 40% of the pollution is because of vehicles. If you can, over the 10 years, you can phase out these vehicles, give incentives, make them cheaper, and slowly we will convert into the electrical, because that will definitely decrease the at least the air quality level. And the other, which they have been doing, I mean, it's more of a political. Punjab, Haryana, somebody says it is burning, somebody says, as you just heard, because of the air quality and the situation, every year we get during these months much more than we get the rest of the year.
Yes.
And they have to think about the power stations taking out. They have to think about, I mean, rationing. Why can't at the beginning every house has three vehicles? Why can't they say that you can't have more than these many vehicles? And unless you sell the old vehicles, you can't get a new vehicle.
But it is also a
Something
function of
like that.
Yes, but it is also a function of creating good public transport. With the Delhi Metro,
Absolutely.
one would imagine that has been created, right, Mr. Jha?
Absolutely. So, despite, but also we need to look at proportionate action. The kind of problem, it's about like, you are in ICU and someone gives you paracetamol. The kind of crisis that we actually have is huge. And despite a very, very efficient metro that we got, still, as in today, there was grap 4. And despite grap 4 bans, as in it took me 2 hours to travel from Noida to Gurgaon, which basically means that it's things like grap 3 and grap 4, and there's nothing called grap 5, but these measures will not help. And therefore, we need to, what Dr. Saab was talking about, that we need to do more than what we are actually doing if we need to reverse this. And indeed, it is going to take 10 years, as in we've been talking about it for the last 10 years. We are okay to talk about it for the last 10 years because we don't have a choice but to live in the city. We don't have the privilege of perhaps moving to the hills, to the Himalayas, or to Goa, or to Bali, or to somewhere else.
Yes.
But that solution can only happen when we start taking that step. Like, it took the government 8 years to bring in 1,000 electric buses, and still we have a deficit of around 7,000 buses already. There's already a law called Construction and Demolition Waste Management and Dust Management, but that's completely flouted. We've had 1,000 trees in a city like Delhi chopped not by anyone else, but the LG of Delhi, Lieutenant Governor of Delhi, actually chopped 1,000 trees. We actually have almost several, more than dozen, coal thermal power plants operating in 200-kilometer radius. When you have such things happening, it's not magic. It's not going to happen. It's not going to happen on its own. It will only happen, and as you rightly put, that why is it so difficult for the central government and the respective state governments and municipalities to come together and look for a solution and take those baby steps? I'm not expecting a clean air. You and I will have this debate again in 2025 with perhaps 800 or 1800 AQI.
Yes.
But perhaps we can hope that this debate doesn't happen at least after 10 years, at least for the next generation, because
Exactly.
it's not a livable city at all.
What the doctor pointed out, perhaps 10 years from now, perhaps if we start today, we are going to have the results of cleaner air. But at this point in time, even at the individual level, we seem to be looking for short-term measures. Questions have been raised, Dr. Chawla, about the effectiveness of air purifiers, and they don't come cheap. How good are they actually at cleaning the air? Because sometimes they create a false sense of security. What do you say they do for us?
The air purifiers, of course, they will be effective in the area where you put it. They are able to clean more than 95% of the dust, the pollen, the smoke present in that. But the problem is, if you open the window for some time, then again you are polluted. So if you want to use the air purifier, it has to be in the same room with everything closed. Windows needs to be closed, the door needs to be closed. And most of the times I advise for patients, people who have patients like respiratory patients or any other, they should have an air purifier. But if you can afford, there is no harm in it, but because you have to go out, you will be exposed to very high. So most of the day you are exposed. But then at night, you may get some relief out of this.
Yes.
It's like having little better than the rest of this. This also is debated, but I somehow, for the time being, and if you buy, it should have a HEPA filter. That also needs to be taken care of.
Yes.
And similarly for N95, uh, is the only mask which can, it is expensive. They need to be made cheaper if they really want people to wear N95 and prevent themselves when they walk outside.
But, doctor, citizens are getting encouraged and motivated and educated to be able to adopt sustainable lifestyle. I don't know how much of that is actually happening, but the move is over there. You hear noises around that, like reducing private vehicle usage. We've talked about that, or managing waste responsibly, segregation, recycling. We talk about all of this. In the meantime, what do you do, doctor? Because, I mean, like you guys said, that we will have to wait longer to stop having this discussion. Because cleaner air is a distant dream for us. At this time, doctor, how do you deal with the situation? Going out, getting fresh air is the normal way to kind of lead a healthy lifestyle. Now you don't have that possibility. What do you do?
You see, whatever you can avoid, you should avoid. That's number one. Because whatever the house inside, you may have indoor pollutants, which you can control if you want to, but outside is definitely much more AQI as inside your house. So don't venture out if it is not necessary. I could see that you've already written. This is very, very important. If you go out, as at least in these 2 months, wear the N95 mask. I don't advise people to go for morning walks now. Please don't go, because it will cause you more harm than help. And whatever you want to do, a light exercise or walk inside your house. And if you take a car, then the window panes, everything should be closed. You avoid outdoor activity. Do not organize functions which are outdoors. And whatever you organize, it has to be indoor. These are little steps which have a very minimal effect, but that's all you can do as of now. But it has to be the air where you stay has to be clean. And I don't know that you hear so much about elections going on, so much labor by the politicians. Why are not they putting all together? If they all come together, all parties, I'm sure the solution will come. Economy is only when we are healthy. Economy will not be able to do anything if we are not healthy, because the car should sell, because these should sell, the
So
purifier
the
should sell.
air needs to be healthy for our economy to be healthy, and persistent air pollution in the national capital is not going to help. In fact, it's a big blot on its image as well. Very quickly, Mr. Jha, it impacts tourism. It restricts foreign investments. If the city is considered not livable, it stops attracting talent like an economic hub should. There will be fallouts. Don't you see that happening?
Absolutely. And there's a World Bank report that already talks about morbidity and loss to business because of bad air. But, one more thing that I want to say, and respectfully disagree with Dr. Chawla, that, air pollution monitor or whatever purifiers are not a solution. There's not a single study that's been done in this world that talks about that, air purifiers are good. It's about corporatizing this entire air purifiers. That's point number one. Point number two is that we can never have private solution to a public problem. The minute we fall into the trap of each citizen trying to find, that's exactly what we did with our water. When we started getting brown water and polluted water in our taps, we started ordering for RO and water purifiers and mineral water and so on and so forth. I think the sustainable solution to air pollution is when you look at the source, when you look at systemic changes, when you look at episodic sources like stubble burning, and the perennial sources like vehicular pollution and construction. That's the only thing. And indeed, we all know that it affects, our economy. But we need to understand and channel, as in, I'm sorry, but yours is a business channel. But there's no business if there are no healthy people. As in 10 years less, a life of every citizen, stunted lung, reproductive, respiratory, and every other disorder that everyone has. What kind of a country that we're talking about?
Indeed. So there is no taking away. I mean, AQIs at 1,000, they're unsustainable for an economy, for a people. If we don't have political will, we're not going to see cleaner air. We're not going to be able to live and breathe clean air, just like the Supreme Court is pointing out. It is a basic fundamental right of citizens, and we are not getting that. At this point in time, it needs to be an agenda item, like Doctor pointed out. Why is it not part of the agenda that governments or even the candidates who are standing for elections are putting forth? We'll have to keep asking for it, and we'll certainly use our platform, ET Now, to be able to sound the bugle, as it were. But thanks very much for joining us with your perspective, Dr. Chawla. Mr. Jha, it's a pleasure having you with your perspective on India Tonight.
If you like this video, then like, share and subscribe to ET Now.